Good morning, everyone. My study is about post-COVID fatigue, quality of life, and cognitive dysfunction, a single-center study. Background: post-COVID fatigue, poor quality of life, and cognitive impairment are seemingly prevalent yet overlooked complications of COVID-19. These aspects are interdependent and interconnected. Symptoms including mood disorders, fatigue, and perceiving cognitive impairment resulted in severe negative impact on resumption of functional and occupational activities in patients experiencing prolonged effect after COVID-19 infection. Planning of long-term medical care provision for the patients after COVID-19 infection to be focused in respect of all stages of medical facility in order to improve the quality of life of such patients. Our objective was to assess the prevalence and association of fatigue, poor quality of life, and cognitive impairment among post-COVID patients. A prospective cohort study was conducted in all patients admitted to the COVID unit, University Hospital, KD, in July 2021. When we recruiting patients, all patients above the age of 18 with confirmed COVID-19, that means SARS-CoV-2 PCR positive or nasopharyngeal swab, with moderate to severe disease or mild disease with any comorbidities were included. Patients who were pregnant transferred from other hospitals directly to ICU care, who de-escalated to ward, and patients who died during hospital stay were excluded. There were few study tools. We used 6-item cognitive impairment test for initial assessment of the cognition. If it is above 3, we use the Montreal cognitive assessment. Then, if it was 18 to 25, considered as mild cognitive impairment, 10 to 17 moderate. If it is less than 10, as severe cognitive impairment. For fatigue, we use 11-item child scale. If it is above 4, we took it as a fatigue. EQ 5D5L questionnaire for a quality of life. Level 3 considered moderate, level 4 severe, level 5 considered extreme. All patients were screened by a physician and a psychologist. Results: there were 153 recruits. Males, there were 54.2% males, that means the majority. Their mean age was 57.2 plus or minus 16.3, and 60% had severe disease and all had comorbidity. Post-COVID symptoms in 12 weeks, that means in 3 months, 54% had arthralgia, 24% got insomnia, and 13.7% got headache. There were other complications, other symptoms, but these were related to our study. The fatigue, it was found in 90% in 2 weeks, then reduced to 63% in 6 weeks, then again to 43% in 12 weeks. It has significant association with arthralgia throughout 12 weeks. So the cognitive impairment. Cognitive impairment was found in only 26 patients in 2 weeks, then it reduced to 9 in 6 weeks, then to 3 patients in 12 weeks. So most of the patients assessed for cognitive impairment had difficulties with concentration, memory, receptive language, and or executive function. Quality of life. So initially there were about 39% had low quality of life, that means in 2 weeks, then it reduced to 23.5 and it reduced to 7.2 in 3 months period. Whereas in only 7.8% told that their health today is less than 50% in 2 weeks, then it reduced to 2% and 0.7. Anxiety and depression. Anxiety depression was seen in 32% of patients, then it reduced to 19.6 and reduced to 5 in 12 weeks. In multivariable logistic regression, fatigue and anxiety and depression were associated with quality of life. In conclusion, post-COVID fatigue is prevalent even at 12 weeks, though quality of life and cognition seem to improve. Patients received good health patient perceived good health, but their objective quality of life was poor, which need to be looked into. Patient might need support to overcome prolonged fatigue, which can impair their functional status. Clinicians should be cautious in interpreting cognitive tests among patients recovering from COVID-19. There are few discussion points. However, cognitive impairment cannot be concluded having clear evidence for the premorbid without knowing the premorbid indicators. Prevalence of depression and anxiety were generally high during the COVID-19 lockdown period, even among the non-clinical population who did not infected by the virus. Hence, depression and anxiety could be a result of pandemic and its impact on the general lifestyle of people rather than consequences of the virus. Thank you.